Hello friends, welcome to Forensic Practicals 4. I am Dr. Manjunath, your FMT Guru. Today we are going to discuss some important exercises, especially drunkenness certificate, some important postmortem cases and important spotters in forensic medicine. Yes guys, hi, hello everyone, am I audible? Am I audible guys? So in yesterday's class, we discussed in detail about exercises like skeletal remains, age estimation, wound certificate, and other important topics. Right? Hi guys, hi. Yes, good evening, Harshit Tripathi. Okay, Harshit Tripathi, no problem. Okay, chalo. Yes, Rakesh, good evening. I'm audible. Audio video is it clear? Just say. Just reply me in chat box. Good evening, Veda Supava. Good. Chalo, let's start. In the beginning, I have one very important question. One very interesting postmortem examination. A case of unnatural death. A case of electrocution, that is high voltage electric current transmission leading to sudden death. The postmortem was conducted as a part of 194 BNSS police inquest to find out the cause of death, to manner of death. Now, during Shawpariksha examination, during postmortem examination, the finding here is, you can see the black color discoloration, and here there you can see brownish nodules. Okay, high voltage burn, contact with the high tension wire. During postmortem examination, brownish nodules are there over the skin. Entry wound is present. Flame burn involving more than 30% of the body. The cause of death is ventricular fibrillation. The manner confirmed by the police is accidental. High tension wire. The question is, what is the finding here? Can anyone answer? Look at this image. You can make out here brown nodules involving the face, the chest, the upper limb. What is this? Rakesh. Srimati Shukumar. This is a case of crocodile skin burn or high voltage burn, okay, or contact burn, the flash burn, flame burn as a result of electrocution. Okay, so the finding here is crocodile skin burn, high voltage current. The finding here, brownish nodules. The cause of death, ventricular fibrillation or respiratory paralysis. The manner is accidental. Most of the organs were congested. Cyanosis was present, petechial hemorrhages almost over the lungs, heart, electrical petechiae, entry wound, flame burn. Okay, so case of crocodile skin burn. Okay, now in today's session we are going to discuss about drunkenness certificate. How to write drunkenness certificate. Basically only the practical aspects. We are not going to discuss in detail about ethyl alcohol, methyl alcohol, ethylene glycol. We are talking only about drunkenness certificate. How to write the correct drunkenness certificate, which is a medico-legal certificate. In the beginning, what do you mean by drunkenness? 3 marks question in exam. As per standard textbook Case and Reddy, 35th edition, drunkenness is a condition. It is a state. It's a physical mental condition produced in a person means male or female, who has taken alcohol in a sufficient quantity to cause him to lose control mental physical faculties. Mental physical faculties means judgment, orientation, okay, awareness, insight. So it includes many faculties, to such an extent that he is unable to execute safely the occupation in which he is engaged at the particular time. That means driver, the occupation is driving. Alcohol affects his driving skills, leads to road traffic accident. Or doctor treating the patient under the influence of alcohol is a classical example of infamous conduct, drunkenness. So, legal limit of alcohol for drink and drive 30 milligram percentage. So, please write in the chat box 30 milligram percentage is a legal limit of alcohol for drink and drive as per Motor Vehicle Act 1985. Anything more than 30 percentage in India, 30 milligram percentage, the blood alcohol level, it is a punishable offense. The punishment can be imprisonment, it can be fine, the cancellation of driving lessons, and other penalties as well. Okay? 30 milligram percentage. MCQ. याद रखना पड़ेगा 30 milligram percentage. Please write this. Srimati Shukumar, Rakesh, Harshit Tripathi. Keep writing. Okay, with this introduction, let's start drunkenness certificate, all the details. So, drunkenness certificate, you need to mention OPD number or IPD number. Okay, OPD number in outpatient department or admitted patient IPD number, MLC number like 24/2026, name Mr. X, age 21, male, female, third gender, address New Delhi police station. So brought by police constable, the constable number and the consent. The consent, see, consent is not required in case of arrested person. Okay, you can examine even without consent in arrested person, arrested as per the law. But consent is mandatory when you are examining a patient who is not arrested. You need to wait till the police comes, till they register case, then only you can examine. Or else you can take the consent, you can examine. So this is what important. Then comes is whether the person is under arrest, yes or no. If yes, date and time of arrest. You can mention date and time of examination and 2 identification marks. So all is our general particulars. General particulars. Okay. Yes, Supava and Rakesh, just write 30 milligram percentage in chat box. So in India, legal limit is 30 milligram percentage. Then brief history about the case as stated by the patient if conscious or accompanied person. Alcohol related questions like type of beverage taken. The beverage can be vodka, it can be beer, it can be anything that you can mention. The quantity, time of consumption, because the level of alcohol in the blood affected by the gastric emptying time, consumed with food or without food, gargling with the mouthwash after the intake, or medical illness related. Like example, there are many conditions which resemble like drunkenness. Like example, head injury, extradural hemorrhage, that look like or resemble like drunkenness. Hypoglycemia, when blood glucose level less than 40 milligram percentage. Diabetic precoma, epilepsy, Parkinson disease, cocaine, morphine, febrile illness, carbon monoxide poison, all these resemble like drunkenness. This can be 3 marks question. Condition resemble like drunkenness. One classical condition is extradural hemorrhage. Okay. Then general physical examination, you can mention build, height, pulse rate, nourishment, weight, BP and all. Orientation. Smell of alcohol from the mouth, a very important point. The smell of alcohol from the breath, a very important point, which confirms that there is a consumption of alcohol. Consumption of alcohol is confirmed by smell of alcohol and smell of alcohol from the breath, as well as the congested eyes, conjunctival, you can say congestion or ingestion. State of clothing, speech, eyes, meiosis, mydriasis, conjunctival chemosis present or not. All these are points must be there. The smell of alcohol is very common with the beer, less common with the vodka. State of clothing, whether properly dressed or soiling of clothes, because repeated fall is very common in incoordination. Speech normal, thick slurred, strutting, confused, aggressive, over precise. You can mention the finding in the case sheet or the drunkenness certificate. Eyes, conjunctival chemosis present, pupillary size, response to light, visual field defects, visual acuity, presence of nystagmus. Alcohol gauge nystagmus is very common when blood alcohol level is around 80 milligram percentage. The question can be asked. Alcohol gauge nystagmus. It is very common when blood alcohol level is 80 milligram percentage. In theory class, we discussed in detail about the stages of alcohol intoxication, stage of excitement, stage of incoordination, and stage of narcosis. So 80 milligram percentage usually a stage of excitement associated with nystagmus. Okay. Yes, Rakesh with a superva, that's great. Bahut badhiya. Is it clear, guys? Up to 12 points, brief history, gender physics examination, orientation, we ask just simple questions like what's the name, what is your age, what is your qualification, where are you, what is your father name, 2 plus 2 is equal to 4, 4 plus 4 is equal to 8. Like that you can ask simple questions just to find out the orientation or to rule out disorientation or to confirm disorientation. Okay, smell of alcohol, when smell of alcohol is there, smell of alcohol from the mouth and the breath, it confirms that there is a consumption of alcohol. It doesn't mean that he is under the influence of alcohol. So blood alcohol level can be less than 30 milligram percentage. It is not punishable. So state of clothing, speech, eyes, okay, yes, बहुत बढ़िया. आगे देखते हैं. Then comes his neuromuscular examination, very very important. Examination for muscular coordination. See, alcohol is CNS depressant. Alcohol क्या है? CNS depressant है. It affects cerebellum. Cerebellum involvement बहुत ही common है. आपको पता होगा cerebellum है ना, very important in coordination. When cerebellum is affected, it affects the muscle coordination. Then you can do certain test, finger nose test, like this. Finger nose test. Finger nose. You must be knowing that. Finger test. Like this, examiner finger, the patient finger. Finger test. Picking a pencil from the floor, gait, walking on straight line. So, 4 common tests commonly we do in forensic medicine clinical examination: finger nose test, finger test, straight line walking test, gait, picking a pencil from the floor. Reaction time. Look for the reaction time, normal, abnormal. Romberg test. So all this just to confirm muscle or stage of incoordination. याद रखना पड़ेगा. Very common Viva question. What are the tests during neuromuscular examination? All these are tests. Romberg test, reaction time, finger test, finger nose test. Then injuries. Sometimes there can be injuries, like example abrasion, चोट, bruise भी हो सकता है, or sometimes laceration, or sometimes incised wound, stab wound. If there is a history of assault, a history of fight between the two parties in bar and restaurant while having alcohol, है ना? Then comes the systemic examination. Examine all the system: CVS, CNS, RS, and per abdomen. CVS, pulse rate, BP. CNS, reflexes, check reflexes whether depressed or normal. Slow respiration, hurried respiration, shallow respiration, deep respiration. And liver cirrhosis, just to confirm chronic alcoholism, hepatomegaly, fatty liver and all. So this is systemic examination. So this is the heart of the drunkenness certificate. Neuromuscular examination is known as essence of drunkenness certificate. Yes, fine. Okay. चलो आगे देखते हैं. Now how to give final opinion. Before that, collection of material for analysis. So one is very important, is blood. Blood is very important. Blood alcohol level. Blood alcohol level is 30 milligram percentage. That means it is punishable offense. So drink and drive, blood alcohol level more than 30 milligram percentage is legally punishable. It's an offense. Okay. From above examination, I am of the opinion that, so there are 3 opinion possibility. Opinion number 1, there is nothing to suggest the person has consumed alcohol. Nothing to suggest. Second, person has consumed alcohol. He has taken alcohol, but not under the influence of alcohol. That is the second possibility. Third possibility, the person has consumed alcohol, but under the influence of alcohol. So he has taken alcohol, at the same time he is under the influence of alcohol. So now how to interpret, how to give opinion, this is again Viva question. Very, very important Viva question. देखते हैं इसमें क्या लिखा है. See, has not consumed alcohol. So what is the meaning of that? Has not consumed alcohol. That means when there is no smell of alcohol, point number 1, smell नहीं है. Okay. No smell of alcohol in the breath. Clinical findings absolutely normal. Visual acuity is normal. Laboratory analysis negative for the blood. So this is opinion number 1. Has consumed alcohol not under the influence, where smell is there, congestion of eyes is there, normal dilated pupil, normal reaction to light, absence of signs of muscular incoordination. All other tests are normal. Finger nose test, finger test, Romberg test, reaction time, everything normal. The only one finding is the smell and the conjunctival congestion of the eyes, red eye. Laboratory analysis positive. Laboratory analysis positive doesn't mean that he's under the influence of alcohol. Okay, so then opinion number 2. When muscular incoordination present, slurred speech present, staggering gait is present, laboratory analysis positive for the blood, then it is opinion number 3. So 3 opinion possibility here. So 1, 2, 3. Now look at this video and what is the opinion here? Okay, opinion number 1 and 2 and 3. Go through this. This is a very funny video just to explain you drunkenness certificate. So 1, 2 and 3. Go through this video. Look at the gait, abnormal gait, imbalance is there, drunken nature is present, okay, total imbalance is present. So blood alcohol level is more than 150 milligram, okay, it is not 150, more than 150. So 150 to 250 milligram percentage. So it's a stage of incoordination. You can clearly see stage of incoordination in this video. My question, what is your opinion? Opinion number 1, opinion number 2 or opinion number 3?
Lalu wajib.
Anyone? Rakesh, Srimati Shivkumar, Veda Supama, Pragyata Agarwal. Yes, Rakesh is telling, so he is under the influence of alcohol. So he is under the influence. So consumed alcohol, consumed and under influence. The classical opinion number 3. Opinion number 2, I said consumed alcohol but not under influence. No consumption, no influence. Then it is opinion number 1. Okay. I hope you understood. Supava, are you there? Any doubt in this drunkenness certificate? Okay. Yes, fine. Okay. Great. Now, next 15 minutes we are going to discuss some important forensic spotters and some post-mortem cases. Okay. So the first case. So look at this. This is a case of homicide, a case of murder as per 103 BNS. The history here is basically a relative, some property issue, property motive tha. So assault between the parties. So the injury caused by the hammer. The hammer was used here. Hammer. He is basically a 40-year-old male. Unnatural death. So case of 103 BNS. Then skeleton was found. The blood alcohol level around 100 milligram percentage. The case of murder, guilty mind and guilty act. Then the body was buried. So body was recovered after 1 or 2 months. The post-mortem was conducted. So during post-mortem examination, there is a finding here. You can see clearly visible 2 skull fractures. So skull fractures are there. So the fracture of hammer, you can know hammer signature is there. So hammer is used. You can see the 2 blows there. 2 blows over the parietal bone and frontal bone. The fracture segments are depressed into cerebral cortex, leading to sudden death. What is this type of fracture? So Rakesh is telling, sir, pond fracture. No, beta, a pond fracture is common in children. So pond in children. Depressed fracture. It's a depressed fracture, also known as signature fracture. So later the accused were arrested and they were sent to jail. The postmortem was conducted as per the law, as per 194 BNSS. So the cause of death in this case, craniocerebral injury. Okay, craniocerebral injury. In this case, blood alcohol level around 100 milligram percentage. So he was drunk, he was disoriented, then he was attacked by the 2 or 3 people with the heavy object, especially the hammer or the stone. So any heavy object having small striking surface can lead to depressed fracture known as signature fracture. There are different types of fracture: linear fracture, hinge fracture, pond fracture, sutural fracture, diastatic fracture, other types as well. Okay. Yes, Shubman, Rakesh, good answer. That's great. So after the class, just go through these fractures: linear fracture, depressed fracture, elevated fracture, comminuted fracture, pond, gutter, diastatic, basilar, groin skull fracture, cranial burst fracture and all. Okay, just go through. This is 3 marks question. Now this is also a very interesting case of postmortem. As you know, postmortem one postmortem certificate is mandatory in your exam. It's a case of 194 BNS. 194 BNS, unnatural death. He was basically a male, a 30-year-old male, found dead at his residence in a case of in a state of hanging. Okay. During postmortem examination, what we found: no depression. Psychological autopsy shows some sexual perversion like transvestism, fetichism. Protective padding was there. For example, this is the neck. The neck. So around the neck, protective padding. So protective padding, partial hanging. So the part of the body touching the ground, that is known as partial hanging. Suffering from sexual perversion, engaged in masturbation. So game is over. The game is over. Life is also over. Anyone, what is this case? शुभम राकेश, ये कौन सा केस है? कौन बताएगा? Anyone? So this is a classical case of autoerotic hanging. Also known as Coatswarism. Sexual hanging. It's an accidental hanging leading to death. Very common in males. So it can be seen in females also. 10:1 ratio. Cause of death asphyxia, venous congestion, the failure of the rescue mechanism. So, okay. I hope you understood this. Rakesh, are you there? Okay. The game is over. A case of death by autoerotic asphyxiation. Now, this is one very, very nice question asked in the exam. Sudden death while having alcohol with the solid food. So, during postmortem examination, what we found, banana inside the larynx. So, stimulating vasovagal nerve or the vasovagal inhibition, leading to cardiac arrest. So, taking solid food, maybe non-vegetarian food, or sometimes banana, roti. So, when it accumulates in the larynx, so like choking, so it stimulates vagus nerve. Vagus nerve is inhibited in the heart, leading to death. Can anyone tell me what is this classical postmortem case? Rakesh? Very good. So, this is a case of cafe coronary syndrome. So, cafe coronary syndrome, the most of the death occur during taking alcohol. It occurs in bar and restaurant. So, alcohol is a CNS depressant. It depresses all the reflexes, including gag reflex. So, death occurs immediately. Death occurs within few seconds or 1 or 2 minutes. So, CPC very uncommon, very rare. It is also known as banana syndrome. Banana syndrome. Okay. How to differentiate between choking and banana syndrome? In choking, CPC very common. Congestion, petechial hemorrhage, cyanosis very common. Banana syndrome, everything normal, no nothing. Only history, taking alcohol in a bar and restaurant, sudden death, mimics like heart attack, coronary attack. It is known as cafe coronary syndrome, also known as banana syndrome. Okay. Hope you are getting my point, guys. Are you there? Banana and alcohol. ठीक है, बहुत बढ़िया. आगे देखते हैं. Now this is very interesting case of postmortem. So the interesting case, you can see the crime scene there. The crime scene showing male, accidental death. You can see the tractor there. Tractor. So death due to walking behind the tractor, 2 handles of the tractor, and there's a pole. You can see the pole there. Cement pole. It's a cement pole. It's a heavy pole. So the incident happened within the basement. So basement in a village. So the chest is compressed between the handle of the tractor and the cement pole. My question is, what is the probable cause of death in this case? Probable cause of death. So the probable cause of death here is traumatic asphyxia. Also known as mosque ecchymotic. ठीक है, mosque ecchymotic. So what are the clinical features? The clinical features are deep cyanosis, petechial hemorrhage, and congestion of organs. Then sometimes there can be clear line of demarcation. So what is the manner? The manner is accidental. Yes, good, great answer. Great, many answered correctly. Now the same one, the same picture now during autopsy. Now I am in the autopsy room now. I am in Bhoot Bungalow room, Shaw Pariksha room, as a forensic expert, as a FMT guru. Now look at the injury there. What is the injury there present? Can anyone identify? ये क्या है? Injury क्या है? ये बताओ. Now look at that. So there is a congestion above the trauma or area above the trauma. There is slightly pale area below the area of trauma. So this is a classical graze abrasion. Seems to be graze abrasion associated with underlying bruise, the bruise of the underlying organs as well. Okay. The classical case of traumatic asphyxia. Okay. ओके बहुत बढ़िया. चलिए आगे देखते हैं. नाउ लुक एट दिस क्वेश्चन. नाउ क्वेश्चन नंबर 5 is a very interesting spotter that can be kept in forensic examination. A picture, image of a male. So image of a male act like a female and female dress. इसको हम क्या बोलते हैं? ये कौन सा कंडीशन है? कौन बताएगा? Acts like a female, dressed like a female, just to get sexual gratification. It is known as eonism, cisvestism, transvestism. Yes or no? So, what is this? Transvestism. If inappropriate clothing, then in cisvestism, also known as eonism. Sometimes it associated with autoerotic asphyxia, AEA, autoerotic asphyxia and death. Okay? This can be a 3 marks question. Name some sexual paraphilia and examples. One very common is transvestism, proteurism. Okay? It's a good answer. Many answered correctly. Okay, बहुत बढ़िया. आगे देखते हैं. Now, what are the types of perversion? Very common 3 marks question. Exhibitionism, exposing genital to the strangers. One question asked in NEET PG. A person standing in a park showing genitals to strangers. Okay. For arousal. What is this? Exhibitionism. It can be of 3 types. Mooning, streaking, aneurysma. Okay. Voyeurism, watching others undress or have sex. Peeping Tom. Fetichism, arousal by non-living object like shoes, underwear. Proteurism is rubbing genitals against unsuspected person. Pedophilia, sadism, masochism, bestiality, necrophilia, transvestism, zoophilia, scatologia, clismophilia, coprophilia, urophilia, all these, just go through this after the class. So very interesting sexual perversion. This can be 5 marks question. Sexual paraphilia, abnormal sexual behavior. समझ में आ रहा ना आपको? Yes, Rakesh, are you there? Okay. Now this is very interesting question, guys. Anyone? This is taken from animal movie. Identify the type of asphyxial death. Asphyxia means combination of hypoxia, hypercapnia. It leads to death. The question here is the constriction of neck at the elbow bend or at the knee bend or sometime the forearm. What is this known as? What are the types? What is the cause of death? Can anyone identify this? बहुत बढ़िया. आगे देखते हैं. Now who is going to answer? Rakesh, Naresh Chaudhary, Veda Supavas, Srinivas, Shubham, Srimati Shukumar, Harshit Tripathi. So this is known as mugging. So mugging can be either breath hold or carotid sleeper hold. Carotid sleeper hold. So breath hold causes occlusion of trachea at the elbow bend or knee bend. Carotid sleeper hold when forearm is placed or leg is placed along the neck. It occludes the carotid arteries. When carotid arteries occluded, that leads to sudden death. Sudden unconsciousness because of stoppage of blood to the higher centers brain for about 15 seconds, 5 to 10 seconds. So that is very dangerous. Carotid sleeper hold is very, very dangerous. It affects the carotid arteries. Yes, okay, that's okay. So all of you write in the chat box, mugging. Just write mugging. आगे देखते हैं. Now look at this. This is again very important spotter in forensic medicine, 3 marks question. It is used in poisoning. What is this basically known as? So this is used in gastric lavers. Gastric lavers. So gastric lavers is also known as stomach pumping. The removal of the contents from the stomach, especially OP poison, opium poison. ठीक है, paracetamol intake, any poisoning except corrosives. So it is not done in corrosives, because corrosive there is a softening of the stomach. It can lead to perforation, but you can do it in carbolic acid. Carbolic acid phenol poison, you can do gastric lavers because there is a hardening of the stomach. So what is this tube known as? Anyone? So this classical tube is known as Avin tube. Avin. Avoid. Bose or Riles tube also. Riles also can be used. Very commonly used Riles tube. Okay. You can see the funnel here. This is the funnel. So this is the proximal end. This is the distal end with the 2 openings. This is the rubber tube, you can see there. Suction bulb. This is a suction bulb. So nowadays in casualty, the one common instrument used is gastric lavers instrument. So this is used in PHC or in some emergencies. Okay, gastric lavers, not done in case of corrosive. So the contraindications, 3 marks question, can be absolute contraindication or relative contraindication. What are relative contraindication? Pregnancy, kerosene poison, strychnine poison, or sometime hypothermia and all. So, okay. So absolute basically that is corrosive poison. Sulfuric acid poison, nitric acid poison, hydrochloric acid. It causes softening of the stomach, high risk of perforation. So except carbolic acid I said. Okay, बहुत बढ़िया. आगे देखते हैं now. Now look at this. This is very, very important forensic spotter asked in your exam. The seeds are very shiny. They are shiny. They have brown, black markings are there. Looks like a tick. A tick जैसा है, shiny है. ये कौन सा है? ये कौन सा poison है? इसका क्या active principle है? Anyone, just identify, because you can go through this in your standard textbook. Anyone? Rakesh is telling, sir, this is castor. Very good. So this is the castor seeds. The scientific name is Ricinus communis. It is very poisonous. It's organic irritant. Organic irritant. It causes hemorrhages and death in around 3 to 4 days. The fatal dosage 10 seeds. The very famous case is umbrella murder case. Okay? Yes. Chalo. It inhibits protein synthesis, RNA polymerase. Now question number 9, very interesting question. In question number 9, what you can see here, blue line is there at the junction of teeth and gum. He is basically painter. came with a history of constipation and pain, abdominal pain, since many weeks or many months, 2 months. He's basically a painter. He's having some CNS manifestations also. During examination of teeth and gum, the blue color line is there. What is this? So this is known as Burtonian line. So this is basically lead line. It's a feature of plumbism. And this is because of lead sulfide. Remember, it is non-specific. Lead poison can be 5 marks question. Burtonian line. Bhumika, very good. Srinivas, Shubham, Rakesh, bahut badhiya. Burtonian line. Good. Now look at this one more condition. This condition is again a chronic heavy metal poison. Chronic heavy metal poison. He's basically a husband. The killer here is the wife. The wife used to mix some poison with his food every day. Every day, some poison. He used to suffer rice water stool since many days, many months. After a few months, he presented with some finding there. You can see here, husband and wife story, bad story. And her Google history is showing that how to kill someone without smell. So what is this compound and what is the poisoning? Anyone? So this is raindrop pigmentation. Excellent answer. Rain drop pigmentation. Raindrop pigmentation. RDP. It is commonly seen in case of arsenic poison. Arsenic is known as king of all poison. So arsenic is the king of all poison, colorless, tasteless, odorless compound. It can be mixed with any food and drink, especially arsenic trioxide. The fatal dosage 100 to 200 milligram. It affects all the system. Okay, raindrop pigmentation, erythromelalgia, Aldrich means line. So all these are the findings. The drug of choice is ball. Arsenic is a 5 marks question. So arsenic is very bad. Arsenic is bad. But remember, one more is there. Thallium is dad. Thallium is there. Thallium is his dad. All of you write in the chat box. Arsenic is bad, but thallium is his dad. You can just remember this dialogue from some movie. Both are ideal homicidal agent. Arsenic, bad. Thallium is telling, no, I am your dad. So, all of you guys, I hope you're enjoying bad and dad. Yes, guys, Srimati Shukumar, Bhumika, Avinash, Srinivas, Rakesh, Veda Supava. Are you getting my point? So arsenic is a king. The queen of king is aconite. Aconite is a cardiac poison, heart poison. So aconite is a queen. Arsenic is a king. Thallium is poisonous poison, very bad. Okay? Thallium is dad. Arsenic is bad. ठीक है ना, like a toxic movie, you know, toxic movie. चलो बहुत बढ़िया, आगे देखते हैं. नेक्स्ट क्वेश्चन, raindrop pigmentation हो गया. आगे देखते हैं. ये देखो, this is a very interesting case, the very interesting case of infanticide. A case of infanticide. We are examining lungs. You can see the lungs. 2 lungs are there. Lungs are floating in the water. They are kept within the water container, orange color container. Okay, the lungs are floating. That means air is there, residual volume is there, specific gravity is around 940, less than water. It's floating. And at the same time, you need to rule out decomposition. For that, we need a sample of liver. Now look at this video, autopsy video. Try to understand, guys, liver. So liver shows no decomposition. Liver is sinking. Liver is sinking, lung is floating. Liver is sinking, lung is floating. What is your inference? ये बताओ Srinivas. Liver is sinking, but lungs are floating because of residual volume. So this is known as hydrostatic test, also known as Ragot test. So this is liver. You can see liver is sinking. Live birth. So live birth, याद रखना live birth, floating, याद रखना stillbirth, lungs are sinking. Again, false positive in putrefaction, false negative in case of atelectasis. Veda Supava, Bhumika, Rakesh, Srinivas. I hope you are enjoying class. All of you guys. ठीक है, बहुत बढ़िया. आगे देखते हैं. Now this is very interesting case. So a case of poisoning. So I am in the now casualty or medicine ward. Look at the patient. The patient is suffering from some poisoning. He came with a history of liver cirrhosis. So liver is showing nodules are there. Jaundice is present. Clearly visible jaundice है. KF rings are there. KF ring है, liver cirrhosis है, male है, 22-year-old male है, and the finding sometime. So now one more same type of case. You can see the bat wing tremor. So tremors are there. Liver cirrhosis hai. What is your best diagnosis? So the best diagnosis, simple, Wilson disease. So that is basically increased copper absorption. It's autosomal recessive condition. It can be copper poison also, chronic copper poison. Okay, so the answer is chronic copper poison characterized by KF ring, liver cirrhosis and jaundice. The treatment is penicillamine, zinc, molybdenate, ball also, flapping tremor. Okay, Shubham Singh, बहुत बढ़िया. Thank you, Shubham Singh. Thanks for your feedback. Look at the video. Very nice video, guys. Very interesting video. This is how you must learn forensic medicine, poisoning. Poisoning is very interesting. Forensic toxicology, very interesting. So what is needed is to understand the concept. Okay. हाँ, ठीक है, ये बहुत बढ़िया, ठीक है, हो गया. नेक्स्ट बहुत बढ़िया. नाउ देखते हैं. नाउ वेरी इंटरेस्टिंग कंडीशन, गाइस. 3 marks question. A case of edema, a case of cardiac failure, and this is the plant, very poisonous plant. We call it as pricky poppy, which has yellow flower. Yellow flower, beautiful leaves are there. Pricky poppy, the seeds are resembling like mustard seeds. So mustard seeds are mixed with some seeds, bad seeds. It leads to epidemic dropsy. The toxic principle is sanguinarine. My question, what is the condition? Remember, this condition is pricky poppy. याद रखना पड़ेगा. अर्जिमोनो मेक्सिकाना. ये क्या है? Epidemic dropsy. Epidemic dropsy प्लांट है. इसको बोलते हैं हम लोग अर्जिमोना मेक्सिकाना, बोलते हैं प्रिकी पॉपी. व्हाट इज द एक्टिव प्रिंसिपल? याद रखना पड़ेगा, सैंग्विनारिन. इट इंक्रीजेस वीनस परमिएबिलिटी, इट कॉजेस ग्लाकोमा, इट कॉजेस एडिमा, एंड इट कॉजेस कार्डियक असाइटिस और डेथ. क्या है? एपिडेमिक ड्रॉपसी है. बहुत बढ़िया. सो आदित्य शरण, बहुत बढ़िया. ओके, आगे देखते हैं. नाउ ऑल ऑफ यू अंडरस्टूड एपिडेमिक ड्रॉपसी. सो राकेश, आर यू देयर? थैंक यू आदित्य शरण. सर, आई लव forensic. What can I do after MBBS for forensic? You do forensic medicine if you want. MD forensic from Delhi, Maulana Azad Medical College. so you can become my junior. I am senior, you are my junior. Getting my point? Aditya Sharan. Funk, yeah, videos are there, many videos are there. Bhumika, are you there? Bhumika, are you there? Sanguinarin, हो गया. Srinivas, बहुत बढ़िया. Sanguinarin, excellent. You're awesome. आगे देखते हैं. Now look at this. Now here is one more very poisonous seed, a poisonous plant, Kesari dal. So having Kesari dal every day, chutney, Kesari dal chutney and Kesari dal vada or Kesari dal or Kesari dal, having Kesari dal chutney every day, it leads to a condition. Anyone, can you tell me what is that clinical condition? Having Kesari dal, beta oxalyl aminoalanine, which causes neurological symptoms, one stick stage, second stick stage, or crawling stage, and death. What is the condition, anyone? Look at this. This is the Kesari dal chutney. Once in a while, okay. Taking Kesari dal chutney every day is very bad. बोलो क्या है? ये है latheriasis. Very good, boys. Latheriasis plant है. Latheriasis caused by BOAA, BO, beta oxalyl aminoalanine. This is known as latheriasis. Latheriasm. ठीक है? There are different types. There are neurological symptoms, or sometimes there can be neuropathy as well. Okay, there are different stages. 3 marks question asked in your exam. Try to memorize this. आगे देखते हैं. Now look at this. This is very poisonous. It's a very common insecticide, malathion. Consumption of 1 gram can lead to death. Death occurs in 6 to 12 hours. My question: what is the mechanism? What is the treatment of this poison? This can be forensic practical spotter. Malathion, insecticide used by the farmers to commit suicide. Even small dosage can lead to death. Very fatal. What is the mechanism? It inhibits acetylcholine esterase. What is the antidote? I'm not going to discuss in detail about that. Antidote is atropine. Anyone, what is the dosage? 2 to 4 milligram IV till atropinization. Oximes can be given after that. So atropine, oxime, gastric levers, diazepam, all treatment options in case of OP poison, organophosphorus poison. They inhibit acetylcholine esterase irreversibly. The aging can occur after 48 hours. There are 2 types of acetylcholine esterase, pseudocholine esterase and true choline esterase. The very important complication is intermediate syndrome. So this is how you can learn about malathion. Atropine, pralidoxime, बहुत बढ़िया. Shubham Singh. Oh, Srinivas Sir, MAMC. Okay. Oh, yeah, Srinivas Sir. Thank you, Srinivas Sir. Srinivas Sir is my teacher from MAMC. Okay, ठीक है. आगे देखते हैं. हाँ, now next question is very interesting question, guys. The question is about watermelon death. The case happened in Mumbai. So I think 4 or 5 people, they found dead after taking watermelon, after taking some amount of biryani, some fried rice. My question, guys, what is the probable condition? Can you identify that? Watermelon, very interesting. Watermelon is very tasty, high glycemic index, very good. My question is watermelon and death. क्या हो सकता है? Sudden death. All died due to neurotransmission. Very small dosage can lead to death. So what is that? Anyone can guess? Aditya Sharan, bye. ये क्या है बताओ? So this is a case of aluminum phosphate and zinc phosphate. याद रखना पड़ेगा. Aluminum phosphate, zinc phosphate, they inhibit neurotransmission. There is no antidote for aluminum phosphate and zinc phosphate. They cause death. Early diagnosis and gastric levers is the only treatment for जिंक फॉस्फेट, अल्यूमिनियम फॉस्फेट, याद रखना पड़ेगा द फेटल डोसेज इज 500 milligram. Fatal period is just 6 to 12 hours. The person dies because of multiple complication, organ failure and death. No antidote. याद रखना पड़ेगा. No antidote. It's a classical rat poison. Rat poison. Grain preservative. Magnesium sulfate can be tried. It produces very poisonous gas. It inhibits electron transport chain. It leads to death. Complex 4. Aluminum phosphide, zinc phosphide. Okay, all of you write in the chat box. Write in the chat box. Watermelon is equal to zinc phosphide. Zinc phosphide. Yes, guys, just write. So watermelon is good, but zinc phosphide is very bad. Probably a case of homicide. So. ठीक है. So look at this. This is the newspaper headline from the Hindu. Rat poison in watermelon killed 4 of a family in Mumbai. Forensic report. So the important duty of doctor in this case is to preserve all the viscera, stomach contents, duodenum contents, half of each kidney, 500 gram of liver along with the gallbladder. So blood, urine, everything to confirm the diagnosis. So forensic investigation is very important in this particular case or any case of unnatural death. I hope you are getting my point. I hope forensic is interesting for you. Yes, Srimati. Come on. Alphus poison. Okay. Are you there, guys? Are you there? Aditya Sharan is telling, sir, very interesting. Forensic is very interesting. Good. Alphus, Shubham, Supama, and Rakesh, are you there? You need to interact with me, okay? You need to keep me awake in the forensic class. You need to keep yourself awake also. So it's beneficial for both of us. So you and me, we are good friends. Yes, Rakesh, are you there? Supama, Srimati Shukumar. Yes, it is definitely more than sufficient, guys. More than sufficient. Supervisor, yes, sir. Okay, Srimati Shukumar. आगे देखते हैं. Now this is very interesting, guys. This is a 3-mark question. What is the type of strangulation shown in the video below? This video is, now look at this. This is a video. Iron rod is placed. Okay, one in the front, one in the back. Iron rod. The twisting of neck between the iron rod leading to venous congestion, asphyxia and death. This is followed in some states, some North Indian states, as a type of torture. So you can see the 2 iron rods there. One end is tied, other end is open. So other end it is twisted. ये है क्या है? ये क्या है बताओ? This is asphyxial death. इसको हम बोलते हैं Bansdola. Bansdola. Cause of death is asphyxia. ठीक है? It can be murder. 103 BNS. Murder. Yes. ठीक है? Many answered correctly. Good. आगे देखते हैं. One more question from hanging. So I am in the postmortem room, a case of hanging. During postmortem examination, I have a finding there. One eye is open, other eye is closed. One eye is open, other eye is closed. People on the same side dilated on the same side of cervical sympathetic chain, the knot area, the knot compressed cervical sympathetic chain, or the ligature compressed cervical sympathetic chain, eye remains open. So what is this finding? This finding is known as left facies sympathetic. Very important question in your exam. Left facies sympathetic. समझ में आ रहा है ना? So this is because of the cervical sympathetic chain compression. It can be feature of antemortem hanging, but it is not the surest sign. Okay, it can be feature, but not the absolute feature of antemortem hanging. The dribbling of saliva is the absolute feature, not the left facies sympathetic. It can be seen even after death, when body is hanged immediately after death. So, okay, so left facies sympathetic. Hope you are getting my point. Many answered. Good. Superb, GB. Great. Now this is very interesting video, very interesting image. So here is a case of gang rape. Have you seen this movie? This is a very interesting movie. Gang rape, more than one person, and age less than 18 years. It attracts POXO case. My question: definition of rape given by, and the punishment given by. Anyone? What is rape and what is the punishment as per BNS? Anyone? Can you repeat? Definition of rape is given by dash. Punishment for rape is given by dash. Dash dash. Come on, guys. Yes, you try to answer. I'm waiting for your reply. Guys. Mamaravello, kogile yello. भूमिका शुभम सिंह, yes, याद रखना पड़ेगा. Definition given by 63 BNS, punishment given by 64 BNS, 70 BNS, rape and murder, that is gang rape. Rape and murder, that is 66 BNS, murder. 67 BNS, याद रखना, 7 मतलब husband. 68 by authority. Okay, 69 झूठा वादा, promise. So okay, झूठा वादा करके सेक्सुअल इंटरकोर्स करना 69 में आता है. ठीक है, याद रखना पड़ेगा. 63 definition of rape, 64 punishment for rape, 66 rape and murder, 67 that is husband and wife during separation. So 68 authority sexual intercourse, 69 that is false promise of marriage, 70 that is the gang rape, 71 याद रखना पड़ेगा repeat offenders. ठीक है, yes, बहुत बढ़िया. So many answering. Srinivas sir, thank you. Bhumika, Shubham Singh, Srimati Shukumar, Baji Rao, very good, all answering great. You are great. So I am now euphoric now. I am in very good mood today. Good mood of taking class. Euphoria. Okay. Now आगे देखते हैं next question. Now I am in the Shaw Pariksha room. So I am entering Booth Bungalow room, MAMC, Maulana Azad Medical College, New Delhi. So during autopsy examination, so look at this. There is something is there. Something is there. What is this something? Anyone identify this? Identify this something. So anyone can identify a case of accidental death, a case of electrocution, cause of death ventricular fibrillation, the manner is accidental, case of one natural death 194 BNSS, no homicide, no suicide, a pure case of accident, winter season, okay, moist hand attract the electric current, skin is a very effective barrier. What is the finding there? Yes, very good. Okay. This is known as Joel Ban. याद रखना पड़ेगा, Joel Ban. Entry wound. are also known as entry mark. Electrocution. Electrocution हो गया, ठीक है, स्पॉटर है, बहुत बढ़िया. Many answered guys, I'm very happy. Many answered. Great. Now look at this same image, it's the same funda, same. Now look at the lower limb over the sole. You can see the multiple wounds are there. Multiple wounds, averted margin. Multiple wounds, averted margin is there. I'm totally confused now. What is the finding here? What is the finding here, guys? Come on, guys, try yourself. Now you are like a detective. You are like a forensic expert. You are going to diagnose this. Now this you said entry wound. I'm okay, I'm happy. The same person. You can see there is one more injury is there. What is this? Is it electrical petechiae? What it is? Is it cyanosis? Is it congestion? Is it petechial hemorrhage? Is it some bite mark? Postmortem artifact? What it is? What it is? Shubham is telling, sir, a exit wound hai. Very good. So this is exit wound, very uncommon, of electrocution. Electrocution. बहुत बढ़िया, very good. Exit wound. आगे देखते हैं. Now next question. Now some spotters in toxicology. Toxicology. Are you there, guys? Shall we discuss some spotters in toxicology as well? Are you there? Are you there? Are you attentive now? Shall I continue for next 30 minutes? Maybe next 15 minutes? Yes. चलो आगे देखते हैं spotters in toxicology. से सानो शुभम श्रीमती. Yes, sir. Srimati is telling, sir. Yes, sir. Yes, sir. Thank you, guys. Hats off. Namaskar. Great. You're just awesome. So you are attending forensic class, and you are explaining, you are answering like a distinction student. You are rocking. Okay. I am bad, but you are answering like the master of forensic medicine. That's great. Now look at this. This is the plant given in forensic practicals. So spotter is given. So look at the plant there. So this plant is having pink color flower. So very common plant, very commonly seen over the roadside, commonly used in criminal abortion. Criminal abortion, CAB. Also used in artificial bruise. Artificial bruise. Criminal abortion punishable under 88, 89, 90 BNS. हो गया. What is the plant? This plant is Calotropis plant. Calotropis. Calotropis can be of two types: Calotropis procera, Calotropis gigantea. Active principle: calotropin, calatoxin, calactin, and gigatin. It's an organic irritant. Organic irritant. White color flower, Calotropis procera. Pink color flower, Calotropis gigantea. So Calotropis procera, Calotropis gigantea, organic irritant, very commonly asked in the exam. Good, many answered. That's great. So भाई देखते हैं 131 and 74. 74 indecent assault है, ठीक है? 131, ठीक है. Good. First question went correctly. Okay, हो गया. हाँ, now this is very interesting, guys. This is a very poisonous snake, which is steel black in color, which has white transverse line. So white transverse lines are there. It is a very cunning snake. So this snake is very cunning, and it has a tendency to bite people in their sleep. So night time, this will try to sleep along with you, along with the humans, because of the body heat. It feels very cold. When it feels very cold, the snake tries to sleep with the human beings. During that, there can be accidental injuries because of the movements of the human beings. The person dies in his sleep. When person dies in his sleep, without any convulsions, without any features, the most probable diagnosis, the poisonous snake, neurotoxic snake, alapide snake, presynaptic. What is the best answer, guys? I'm giving you lots of clue. Lots of clue. ओके, ये है कॉमन क्रेट है. What is the scientific name? Scientific name is Bungaru ceruleus. Okay, you can make fun of the word Bungaru ceruleus. What is the name? Bungaru ceruleus. Presynaptic. Presynaptic है. Fatal dose है 3 to 6 milligram. Cause of death, respiratory failure. Respiratory failure. It resembles like stroke. More paralysis, less convulsions. Local symptoms are very minimal. Swelling is very minimal. Okay. Local symptoms are almost negative. It is one of the example for negative autopsy. Negative autopsy. Obscure autopsy. So common crate. Crate, Bungaro toxin. Shubham, Rakesh. बहुत बढ़िया. Yes, you can ask me Anshu epic play. If you want, you can ask me, no problem. आगे देखते हैं. Now very interesting spotter from the forensic medicine. All of you guys look at the seeds. So seeds are kidney shape. Kidney shape. Double-edged, brown in color, ठीक है, bitter in taste, somewhat bitter, not good for health. What it consists of? It consists of atropine, it consists of hyoscine, hyoscyamine, and traces of, that is atropinizide 9D manifestation. So after taking this drug, after consumption of this drug, the patient presents with dysphagia, difficulty in drinking, difficulty in having food, difficulty in talking, dysarthria. There can be muttering delirium like this, muttering delirium, carpologia. So 9D manifestations, dryness, dilatation of blood vessels, red as a beet. So mad as a wet hen, like that. So mnemonic is there. So what is the best diagnosis, guys? Chili seeds? No. Hot as a hair? Good, very good. Dry as a bone? Some are answering chili seeds. No beta, ये chili seeds नहीं है. ये है दत्तूरा seeds है. दत्तूरा seeds. Treatment है physostigmine. So these seeds are mixed with the chili seeds, used as a road poison. So when you are traveling by bus, when you are traveling by train, long train, never share your food with a stranger person. Because who knows, the stranger having anna sambar, having roti curry, the curry might contain datura. After taking datura, the person becomes unconscious. The person becomes totally confused, delirant. So that opportunity used by the criminal to robbery, kidnapping, sexual assault, or sometime, other offences basically. So never share food with a stranger while on long journey. So that is the key line from the today's class. Stupefying drug. Good. Shubham. Great answer. So Datura is equal to road poison. Write this in chat box. Datura is equal to road poison. Road. Excellent answer. आगे देखते हैं next question. The next question is a very interesting question. Look at this. This is Datura fruit, spinal projections. Okay. So datura fruit known as thorn apple. So this is the thorn apple. Very bad. This is apple. Very good. Apple is good, but thorn apple is bad. But remember, apple seeds are very bad. Apple seeds are very bad because they consist of very high amount of cyanide. So thorn apple is bad, but apple seeds are thorn apple's dad. Okay, you can remember like that because it consists of very high amount of cyanide. So taking maybe some amount of seeds, maybe 100 to 150 seeds, leads to cyanide poison and death. So they are toxic. Cyanide poison, very toxic. I hope you are understanding. Thorn apple is bad, but apple seeds are very bad. Okay, not bad, very bad. So Veda Suparva, Shubham, very good answer. Excellent. ठीक है, बहुत बढ़िया. आगे देखते हैं. Now next question. Oh, next question is very interesting question, guys. Look at this question. This question, you can see the spiny projections over the fruit, over the capsule. You can see here, like this, spiny projections are there, and the multiple are there. So there are multiple like this. So they are in clusters. So they are in clusters. Identify this poisonous plant. So what is this plant? This plant is Ricinus communis, also known as castor plant. So active principle resin, umbrella murder case. Cluster is equal to castor. Castor oil is non-poisonous. MCQ. ठीक है, हो गया. आगे देखते हैं. Yes, most dangerous is apple seed. So Shardul, I think you are enjoying class. Shardul, good, resinous. Okay. Now fifth one. Fifth one देखते हैं. Oh, this is already we discussed. Don't worry. This is again very very important plant. Very commonly asked in Viva. Very commonly asked in your exam. Identify the plant. What is the active principle? And what is the medical legal importance of that? So this plant is basically Papaver somniferum. Papaver somniferum, also known as opium plant. The question can be asked, what is the active principle? Active principle is morphine. What are the clinical features? Coma, pinpoint pupil, respiratory depression, respiratory problem. That's why contraindicated in case of asthma, head injury. So triad is coma, pinpoint pupil, respiratory depression. Treatment is naloxone, naltrexone, methadone. The consumption of this plant is punishable offence under NDPS Act 1985. NDPS means New Delhi Police Station. No, NDPS is not New Delhi Police Station. NDPS is Narcotic Drugs and Psychotropic Substances Act. So according to this, every offence is non-bailable, non-compoundable, and cognizable. Okay, this can be, and this is commonly used in infanticide. It can lead to accidental infanticide. Also used in suicide, rarely homicide. Sometimes it can lead to accidental death. ठीक है? Papaver somniferum. So this is common. This drug is a very important drug. It is used in cancer pain. So it is used in cancer pain syndromes. It's a very good drug. It acts on different receptors, mu receptor, kappa receptor, and delta receptors. It produces very good analgesia, supraspinal analgesia. Okay? Papaver somniferum. No, jotege idala. Srinivas jotege idala. Papaver. Okay, great. Hope you understood, guys. Is it clear? This Potter forensic medicine, Papaver somniferum. Then withdrawal symptoms can be asked. In simple word, cold turkey. The cold turkey is the name given to withdrawal symptom. Delirium tremens is the name given to alcohol withdrawal symptom. MCQ. Magnum symptom is the withdrawal symptoms in case of cocaine poison. ठीक है? Yes, बहुत बढ़िया. आगे देखते हैं. Now this is very interesting. कन्वर नहीं, कन्वर लाल बोलो. कन्वर नहीं, कन्वर लाल बोलो. है ना? ये क्या है बताओ? Anyone. This is used in case of dog killing, and it looks like chips. It looks like a banana chips. Very important. It has a central depression and hair. It consists of strychnine, nux vomica. It's a nux vomica seed. Fatal dosage 1 seed. Fatal dosage 1 seed. Fatal period 12 to 24 hours. याद रखना पड़ेगा. 1 crush seed. ठीक है? Good. आगे देखते हैं 7th one. Now this compound in forensic medicine, guys. Try to answer. Rice water is stool. I'm giving you clue. Rice water is stool. Colorless, tasteless compound mixed with any food and drink. Raindrop pigmentation. Then Aldrich means line. So ideal homicidal agent. King of all poison. Fatal dosage 200 milligram. Drug of choice is ball. What is the answer? The answer is arsenic trioxide, also known as Sankhya. ठीक है? It is not phosphorus, seems to be arsenic. Chalo, I'm not going to discuss in detail about that. Now look at this. This is a very interesting question. What is the chemical compound present in sindoor? Sindoor, now synthetic sindoor nowadays. So what is the component of that? एक चुटकी सिंदूर की कीमत तुम क्या जानो रमेश बाबू. It's one of my favorite movie. So Om Shanti Om. In that movie, favorite dialogue. एक चुटकी सिंदूर की कीमत तुम क्या जानो रमेश बाबू. My question is, what is the heavy metal poison caused by sindoor consumption? Sindoor water. Anyone? So this is basically mercury sulfide, or it can be lead tetroxide. याद रखना पड़ेगा. Mercury causes minimata disease. Lead sulfide causes saturnism. This causes encephalopathy in children. Okay. So lead poison 5 marks question. Mercury sulfide is also 5 marks question. Try to memorize. So try to repeat after the class. So arsenic poison, lead poison, mercury sulfide poison, very commonly asked. Okay. Good. And the 9th question. What are the tests for alcohol concentration in the body? What are the tests? So there are basically different tests are there. So this can be asked in your exam. So alcohol is a CNS depressant. It's a commonly used party drug. It is commonly associated with road traffic accident, sometime sexual assault, sometime aggressive behavior and assault, misconduct in public, misconduct in party. Test for alcohol concentration in the body. So one commonly used is breath analyzer. ठीक है? It works on Henry's law. Second test is cavite test. Gas chromatography. Then you must know what is Widmark formula. Widmark formula is equal to A is equal to CPR. So we discussed this in FARRE classes. A is equal to CPR. A means alcohol concentration, C for blood alcohol concentration, P for body weight, R for constant. So constant in male 0.6, in female it is 0.5. Okay. So any other test? Widmark formula, yes, Srimati Shukumar, that's great. Great. Okay. Chalo, okay. And the last question of the day. The last question is, some poisonous seeds are there, some poisonous seeds. It leads to paralysis. Already we discussed in the beginning. Paralysis, neurological symptoms. ये क्या है? ठीक है. So this is basically लेथरियासिस है ना. लेथरियासिस सीड है. ये है केसरी दाल. केसरी दाल. Active principle BOEE. BOEE. So this completes your today's session, guys. Rishank Dusane. Any doubt you can ask me, guys. So we completed all important spotters and we completed drunkenness certificate in 4 classes. Injury certificate is discussed in detail over. MCCD briefly. Skeletal remains discussed in detail. Age certificate. So especially X-rays. X-rays are usually not asked in your exam. X-ray and age estimation. Dental examination commonly asked. Drunkenness certificate. Examination of victim of rape. Examination of accused of rape. Some postmortem certificate. And we discussed more than 100 spotters in FARRE classes. More than 100. More than 50 cases of postmortem. Variety of cases. Like example, banana syndrome. Then banana syndrome, traumatic asphyxia, many cases, okay, in detail. I hope you are getting my point. I hope forensic classes are useful. I'm waiting for your feedback. Your feedback is very important, guys. If you have any doubt, you can ask me. Rishank is asking me one question. Rishank, one of my favorite student. Rishank, are you there, Rishank? Rishank question is, what is the question, Rishank? Why pupil is dilated? So yes, very good question. Why pupil is dilated due to alcohol, but later it is constricted by stimulus? See, alcohol intoxication in alcoholic coma. So alcoholic coma. This is very interesting question. Alcoholic coma, pupil is constricted. Why? Because it is coma. In coma, activation of sympathetic system. Sympathetic system. Yes or no? So, but on giving stimulus, it gets dilated. That is known as Messivan sign. Okay? Rishank, I have forensic practical on 22nd. All the best. All the best, Rishank. Do well. Do well. Okay? Sir, in our college, see, you can mention others. Okay, good question. The question by Mr. Shubham. Shubham, male, female, and others. Any new certificate now, there is a column others. You can write others. Getting my point? Others is others you need to write. Srinivas is asking, sir, notes in method is very little. Better. You need to write exact points. It is not about the pages, it is about the content. Okay, like example, rigor mortis, you can answer even in 1 page also. It all based on your hard work, based on revision, based on practical application. Write more about medico-legal significance instead of more theory. So write some diagrams. Okay, ठीक है. Shubham, Rishank, you have taught nicely by images and all. Thank you, Rishank. Wish you all the best. All the best for upcoming practical exam. I'm sure you are going to get at least 75 plus. At least 75 plus. I know your target is 80 plus. All the best. Shubham, thank you, sir. So, superb, any doubt? Any doubt in today's lecture? Rakesh, one of my favorite student, Rakesh and Veda Subhava. If you have any doubt, you can ask me for next 5 minutes. I'm there for 5 minutes. ठीक है? 5 minutes. Good, Rishan. Good. Yes, Srimati. Thank you, Rakesh. So this I'm going to give you the answer in WhatsApp. Okay, Rishank? What is the principle of thank you all.